Oh, Papa, you're so cute, but oh, Papa, my dear.
Are you ready for surgery?
Huh? Oh, yeah. Mommy, Papa.
What? This isn't a good environment for surgery. You can't have that. You need to be wearing gloves first. And also, where's the light? Where's the air? And these people need to be cleared out of here first. We need better conditions in here. And let me take him from you before you go into surgery. It's for better. It's for your health.
Okay. I love you, Papa.
And I'm taking this too, and we'll be back for surgery.
Florence Nightingale was born on May 12, 1820 in Florence, Italy, and she was named after the city. Her family was very wealthy and she was expected to live the life of culture and a lavish social life. But she strived for her own independence and she felt that it was a calling from God to pursue a life in nursing.
Florence, you are a disgrace to the family name. You have disappointed this whole entire family.
But Mom, it's a calling from God.
You and your nursing rubbish. What is that? I don't want to have anything to do with you.
Well, I'm going to the war anyways.
Go off, you and your rubbish nursing blah.
In 1844, she decided to work in hospitals as a nurse. Her family was extremely upset by this since hospital conditions were terrible and nurses were not highly regarded at that time. In 1849, she visited a German training school for nurses and teachers. This school had a religious foundation for the relief of poverty and she trained there for 3 months. In 1853, she became the superintendent of a London charity for gentlewomen during illness. In 1854, the Crimean War broke out. The British soldiers lacked quality of care for war casualties and many died. The Secretary of War asked Nightingale for her help and she quickly gathered 38 nurses and went to help the soldiers. She worked very hard to improve war casualty conditions so that they could be treated effectively and humanely. Many people were pleased with her work and she was highly respected and often called an angel with a little lamp in her hand. And the lady with the lamp legend began. She became sick herself with Crimean fever and had no choice but to return home to London to recover. She became very ill, but she still was influential around the world with her extensive writings. Her main focus was with her writing about hospital conditions and hospital hygiene. Since she believed that nursing is an act of utilizing the environment of the patient to assist him in his recovery, she advocated for hospitals to provide good light, ventilation, and good spacing of beds. She also believed that irrigation was a solution to the problem of starvation. In 1857, she published the Notes on Matters Affecting the Health, Efficiency, and Hospital Administration of the British Army. In 1860, she published Notes on Nursing. In 1863, Notes on Hospitals and the Prevention of Venereal Disease Among Prostitutes. In 1860, funds were raised to honor her contributions in the war to start a training school for nursing. The Nightingale School and Home for Nurses was established at St. Thomas's Hospital. It was with her principles and her school that laid the foundation for modern nursing. In 1907, Nightingale was the first woman to be awarded the Order of Merit. She died on August 13, 1910 in England. In 1982, the Florence Nightingale Museum was started, which holds an exclusive collection of artifacts and holds a piece of the story of the lady with the lamp.
Florence Nightingale developed the environmental theory of nursing from her Notes on Nursing. She stated that nursing is an act of utilizing the environment of the patient to assist him in his recovery. It involves the nurse's initiative to configure environmental settings appropriate for the gradual restoration of the patient's health. These external factors associated with the patient's surroundings affect life processes and the patient's health. The theory involves utilizing the environment of the patient to assist him in his recovery. In doing so, the nurse can manipulate the environment using 5 factors. These factors include fresh air, pure water, efficient drainage, cleanliness, direct light, and direct light. Deficiencies in these factors can prolong illness and lead to worse health. Like so.
The purpose of Nightingale environmental theory was to assess the psychological and human needs of patients. When doctors were not convinced for hand washing, she was able to assure them by saying that the proper use of fresh air, light, warmth, cleanliness, quiet, and the proper selection and administration of diet, all at the least expense of vital power to the patient. Concepts and definition of Nightingale theory. Fresh air is to assure good ventilation. According to Nightingale, patients' rooms should be ventilated by opening the windows. This can keep away toxicity and keep the room fresh. Cleanliness. It's crucial for both preventing disease and for helping patients recover. To avoid health hazards, also change, wash, and air out bedding. Environment. It includes light, attractive room, calm, noise-free, and warm environment for patients. Nightingale insists that patients' human needs for light and attractive room are important for recovery. Communication. Includes advice, assurance for good such as nothing wrong with patient. She asserts that patients do like to hear good news from the outside and asks that visitors be more sensitive and empathetic about the patient's current situation. Nightingale agrees to the miasma theory, which explained the spread of disease through noxious airs. So, she agrees with good hygiene. Especially in the 1800s, hospitals were crowded and unsanitary. Because of that, she highlighted good hygiene in configuring a patient's surroundings.
Florence Nightingale's environmental theory was very unique. Her statistics proved that environment was sometimes not only the setting for disease, but also sometimes the very cause, and the ideas that came from her research impacted hospital planning and design.
Florence Nightingale believed that the external environmental factors influence the patient's recovery. Much of what she instituted is still the basis for practice today. We still practice good hand-washing techniques. We ensure the cleanliness of both the patient and the hospital by changing sheets, bathing the patient. We encourage positivity in the visiting guests. We maintain the patient's proper nutrition and diet. We ensure there is proper ventilation in the rooms.
We really enjoy learning about Florence Nightingale.
It is fascinating to see how much influence her beliefs have on what we practice today.
It's amazing how something so simple as hand washing wasn't as frequently implemented.
She truly set the groundwork for nursing today, and we are all very thankful for her.
I want to follow wherever you should pass, right?
Yes, follow in my footsteps.
I want to follow on her footsteps.
Me too.
Me too! I solemnly pledge myself before God and in the presence of this assembly to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous and will not take or knowingly administer any harmful drugs. I will do all in my power to maintain and elevate the standard of my profession and will hold in confidence all personal matters committed to my keeping and all family affairs coming to my knowledge in the practice of my calling. With loyalty will I endeavor to aid the physician in his work and devote myself to the welfare of those committed to my